Good afternoon, ladies and gentlemen. The 22nd National Situation Report since the confirmation of the first case of the novel coronavirus disease, Covid-19, in the Gambia on the 17th March 2020 reveals the following. 1. 4 people who sneaked into the country through the land borders were found through a community tip-off to the 1025 hotline and have been taken into quarantine. Sites have been secured for makeshift COVID-19 treatment centers in all the health regions in the country. Western 1 and Western 2 health regions continue to register the highest number of calls to the 1025 toll-free hotline. The 4th case that has been diagnosed in this country is still on admission and is responding to treatment. A total of 76 new laboratory test results have been received recently. 5 were positive, 1 inconclusive, and 70 were negative. 2 of the confirmed cases were in quarantine and later on home isolation on account of recent travel from the United Arab Emirates. 1 other confirmed case was in quarantine and also later on home isolation on account of recent travel from the United Kingdom. The remaining 2 confirmed cases are still in quarantine for being close contacts of the 4th confirmed case. The inconclusive case also has a travel history of recently returning from the United Arab Emirates. Currently, the country has 6 active cases, 2 of which were locally transmitted. We have 2 inconclusive cases, 2 recoveries, and 1 death. To summarize again, the Gambia has recently registered 5 confirmed COVID-19 cases. Globally, since 31st December 2019 and as at 10th April 2020, a total of over 1.6 million cases of COVID-19 have been diagnosed, have been reported. Of these, there were over 100,000 deaths, over 370,000 recoveries. Senegal, our neighbor, recorded 265 confirmed cases, 137 recoveries, and 2 deaths. Currently, we have 47 people on quarantine in one of the hotels in the Greater Banjul area. A total of 282 A total of 281 tests were conducted and 9 were positive, 270 were negative, and 2 were inconclusive. 253 people completed quarantine, 233 contacts have been traced so far, and 310 people completed follow-ups. With regards to the coordination, case management, logistics and security, laboratory and surveillance, as well as risk communication and community engagement, the following activities were carried out. Daily coordination meetings, ongoing at both the strategic and technical levels. We are intensifying the conduction of laboratory tests for a wide range of people. Case management and infection prevention and control training of health facility staff, covering both public and private health facilities ongoing, and the provision of regular psychosocial support for people in quarantine as well. The fourth case is still receiving treatment and his condition remains stable. The 5 new cases have been taken to join him at the government treatment center. In the area of logistics and security, all the regions in the Gambia have received stockpiles of personal protective equipment. Risk communication and community engagement activities are ongoing and are being intensified. In the next steps, the Ministry of Health, in collaboration with partners, will intensify the following actions. We will partner with other stakeholders and communities to continue with the massive sensitization on COVID-19. We will follow up and provide continuous psychosocial support to the affected communities, persons under quarantine, people who have just been discharged from both quarantine and the treatment centers. We'll also continue daily follow-ups of low-risk contacts and those discharged from the quarantine centers as well. We encourage public reporting and self-reporting of high-risk individuals through the toll-free number 1025. We'll also be engaging inspectors of the State of Public Emergency Regulations 2020 and documenting best practices of compliance while identifying challenges that require urgent attention in the interest of public health. Finally, I would like to appeal to the regional governors, to the district authorities, the ward development committees, the councillors, village development committees, religious and other community leaders, heads of women groups, heads of households, and family members to be very vigilant and ensure the full implementation of the suspension of public gatherings in whatever form, and to ensure the practice of social distancing. This strategy will certainly help us reduce the spread of the virus in our communities, and it becomes more relevant now that we have started to register local transmission. I would like to conclude by commending all the communities that established and support the work of the community vigilantes in tracking people entering into the Gambia from affected countries and communities along the borders. The Ministry of Health salutes this important community initiative and will urge all communities in the country to embrace and establish such community COVID-19 monitoring structures. Community participation and involvement in the COVID-19 interventions is essential. Together we can make a difference in our efforts against COVID-19 in the Gambia. Once again, I thank you very much for your kind attention.